The broadcast is now starting. All attendees are in listen-only mode.
Hello, and welcome to our webinar on the Pathways proceedings from our State of the Science Conference. Before we begin our webinar, I just would like to remind everybody to move any electronic handheld devices such as cell phones away from computers and speakers. That prevents feedback. And so does closing all file sharing applications like Pandora or Facebook or any of those likes. And so during the presentation, you can send questions to us, and these are going to be held to the end, and you can just do that through your question chat window because all the audience members are going to be muted during the call. A recording of this webinar and the slides will also be available at the end of the webinar on our website with the URL being below. So next. So welcome to Promoting Positive Development Among Emerging Adults with Serious Mental Health Conditions. These are, like I said, the results from our Pathways State of the Science Conference. Today we're going to do an overview and structure of the State of the Science Conference, as well as an overview of our Pathways to Futures model. And then we're going to review some key themes that emerged at this State of the Science Conference. And those themes were family support, peer support, and diverse social identity. So this conference took place earlier this year in lovely Portland on May 20th and 21st. Next. And the goal of it was to bring together expert stakeholders to address key topics and questions related to our Pathways model and the implications for practice and policy. And this model, we derived it from evidence on how to best support and serve young adults with mental health challenges. So that's going to be the main thing that we'll be talking about today, is how to best serve these youth and young adults through our model and the research and by talking to other stakeholders. So the conference structure, just to give you a sense of what we did, it was limited to 50 participants on day one, and those were researchers, practitioners, administrators, and also young people. Approximately 25%, if not a little bit more, of the participants were young people with experience, families, and policymakers. And mostly what we did was we used discussion-based sessions, so more talking, less listening, accompanied by worksheets to guide our issues. And so those served as the data that made up our proceedings. Day two, we were lucky enough to have an overlap with the Healthy Transitions Initiative Conference. And so we did this on purpose to tap their experience and expertise to get their views of what we had been learning so far. So that increased day two to 120 participants. And the goal of that day was to discuss issues that arose during day one that posed particular challenges and unexpected issues to serving youth and young adults. And just so you know, all of the proceedings are available on our website. So you can search Pathways RTC to find us. And next, if you go to the publications, you will see there's a page called the State of the Science Conference Proceedings, and that is separated into different chapters and includes a chapter on the model, working with people from diverse backgrounds, social support, and how agencies can both support and or sometimes have barriers to implementing the model that we're going to be presenting. And there's other chapters as well, but it's all available as a whole document, or you can download chapters separately. Next slide. And so you can see the list of the chapters. And so without further ado, I'm going to turn this over to Janet Walker, who's going to discuss our model.
Hello, everyone, and thanks, Chris. That was Chris Gowan, our Director of Dissemination. I'm Janet Walker. I'm Director of the Pathways Research and Training Center. And before we sort of launch into a discussion of the model, I think it's kind of important to think about why bother. We put a lot of effort into developing this model. We're going to tell you about that. And so it's sort of natural to think about what is the purpose of a model? Why bother? So you don't have to go very far into the literature to see that academics and other developmentalists think that it's really important to be clear about how to describe the way that things providers actually do when they're working with young people, why that promotes outcomes. Or in other words, what is it exactly that providers do that activates change? And additionally, we all hear, and certainly we're used to saying ourselves, that this is a unique population that needs a special approach, and part of what we wanted to specify in our model is, well, what exactly is it that's unique in the approach, and how can we make sure that people are doing it if it's so special? So again, why should we even care about a model? So probably a lot of you are familiar with studies. This research has been going on for probably 30 years, and it continues up to this day, with similar result for adult psychotherapy, that the general idea being that any therapeutic model is pretty much as good as another one, and they all have a pretty decent effect. And that phenomenon has been described as the common factors across models. Fewer people know a kind of corollary that's emerged from this research, that in normal community practice, where people tend to take an eclectic approach, that, or in other words, a model-free approach, that the net effect of adult psychotherapy is pretty much nothing. And recently in children's mental health, over about the last decade, the same result has been replicated, showing that the net impact of no model kid psychotherapy is also pretty much zero. So this sort of points to the idea that there is a benefit to having a model. And maybe the benefit of the model might be more important than what the model actually is. But we can see why that might be true, and again, there's some research around this as well. At the individual level, it helps people to have a clear understanding of what they're doing and why, what are these active ingredients, and then do more of that. And then at the group level, if you think about it within an agency, or between an individual and their supervisor or group supervision, it's obviously much clearer to communicate about practice and to evaluate practice if you have a clear idea of what the active ingredients are and how to talk about that across different people and work on that in supervision. So when we went out to review programs, we found that even in many of our well-regarded programs that we looked at, there were quite a few that had a basically eclectic approach. So probably we think that building a model into that could be helpful for them. Others, approaches that we reviewed do have manuals, but even these programs, and this would be something that the developers of the programs would themselves even talk about, that it tended to lack of actually a very full model of understanding this in the context of development. So the sort of bottom line for all of this, and we can't really do justice to the model here, but I really want to encourage you to look at the section in the proceedings called Pathways Model Overview in the Proceedings, because I'm not going to be able to get into it with a lot of detail since I've been allocated 7 minutes to talk. So just to review again some of this work that we did, we started out to build the model with an initial review of the literature. We're looking at approaches that had some level of evidence to support them. These would not be yet considered evidence-based practice because that's a more rigorous standard, but that there were certainly very pronounced common elements among these approaches, even though they had been developed for so-called different populations in a way that they were young people who had serious mental health conditions, but they might be primarily identified through child welfare, through the homeless population, through corrections, or just in the community. So we developed our initial model based on that, and then we had multiple levels of review. And that included having feedback from our academic friends who were both researchers and theoreticians in the areas of development as well as in emerging adult mental health specifically. Then we also submitted it to providers, and this included both direct service providers for their feedback and to administrators in well-regarded programs. Then we also talked to participants in those well-regarded programs, including young people who were being served and their family members. And then, of course, the conference itself was basically a full-time exercise in getting more feedback on the model. And you'll hear from folks today about what some of those areas of feedback were. So essentially what emerged, again, extremely clearly from all of these different stakeholders was the importance of taking what we call a positive developmental approach toward serving young people with serious mental health conditions. And that sort of approach focuses on promoting competence and the acquisition of skills and assets, and that the task, as you can see here on the slide, of development during this age range or this stage of life is the same regardless of whether or what challenges are being part of life. And in fact, when people experience challenges, the opportunities for growth and development are even more crucial because that's what provides motivation and skills that improves a person's ability to overcome those challenges and cope. So here we have what we consider the key task of emerging adulthood, or a key focus of efforts to intervene. And that is, once people develop this ability to drive their own positive development, they will quite naturally move themselves forward toward positive developmental outcomes, including the ability to meet their basic needs and the needs of their dependents, and the ability to take on roles in family, community, and society that they find personally meaningful. So this key task of emerging adulthood is to really learn how to be the one who is driving their own development. And in order to do this, it requires that you are able to tap into your own intrinsic motivation. So what is actually going to keep you moving toward your future, especially when things get hard. Then the ability to be proactive, to see what you want in the future and think about how to go about that starting from now, how to take small steps that are eventually going to get you somewhere that you want, how to solve problems, and how to assess your progress. Then you need the ability to engage with life contexts, all the way from significant others and important very close relationships to family, community, and even connections with organizations such as a workplace, university, college, etc. And then finally need, of course, to be able to manage the ups and downs that occur when this happens. And we know that young people who have been involved in systems as they grow up are frequently kind of haven't had much in the way of opportunities to develop their own ability to be proactive and to drive their own development because systems expect and kind of promote kind of the opposite, which is compliance, and often is just a model of reactivity. So even the people around you are not modeling a proactive approach. So what we describe is a process where providers have a structured and intentional process that is very replete with strategies to help young people learn how to drive their own development. And throughout this process, the providers act essentially as coaches who use, repeat, and reinforce key skills and procedures and tools. And these are, again, the tools for driving one's own development. And these are tools that are learned in the intervention, but that are useful and can be applied in other contexts as well. So the idea is to create knowledge that can serve them outside. Then also to work in a specific sort of practice mode that is motivational, or as Martin likes to put it, Martin Rafferty, who you'll be hearing from in a minute, leading from behind and guides without manipulation. Now this last piece is just is actually a little bit subtle, and it's kind of the crux of the whole model, which is a shame I'm not going to be able to go into it more deeply, but I do encourage you to check out, there's sort of 8-page description of the model in the proceedings. So our hypotheses from all of that is what it takes to activate change, that within the context of these positive development interventions, we will have more change when providers have a clearer theory of mind, a theory in mind about how they activate change, that they can work in this practice mode, motivational, as I noted previously, and is described in the proceedings, that they have a sufficiently large toolbox of skills and techniques that they can use and also teach to the young person that helps with this process, and that they are always alert to the possibilities so that they're intentionally using this aspects of this practice mode and teaching the toolbox of skills and using their own skills so that practice is dense with intentional strategies. And essentially, so that this density, I think, is also possibly what determines the effectiveness of model-based practice versus no model practice, is that allows you to integrate more of what activates change. And it's not usually that the strategies that are used in eclectic practice are that different, but that more intentional and model-based practice is actually more dense with the same kind of strategies, just more of them. So essentially, this is sort of our hypothesis about what having a model does for you as far as making your intervention more effective. Okay, thanks.
At this point, we're going to transition into talking about some of the challenges and strategies that were discussed at the conference. My name is Pauline Javanji, and I'm going to be talking today about both challenges and strategies in promoting and maintaining family support. While the model supports emerging adults to become responsible for driving their own lives, for many young people with a serious mental health condition, the family is the most important source of support. However, challenges can arise when family members don't understand mental health issues, or when there are different perspectives on the emerging adult's goals, activities, or whether or the extent to which family members should be involved in treatment or decision making. So the first challenge that participants talked about was balancing the independence and family involvement, and there are cultural variations here. Families struggle between being appropriately supportive and encouraging their emerging adult to become independent. In some families there's more emphasis on becoming independent, but for some families there are culturally based expectations for continuing close relationships with their emerging adult children and placing more emphasis on maintaining connections. So it's important to find out what's going to work best for a particular family. Families may not understand mental health and/or the developmental expectations of emerging adulthood, and therefore they may have unrealistic expectations about their emerging adult child's capacity to transition successfully into adulthood. If they don't have understanding of mental health issues, they may have difficulty coping with behaviors that don't make sense, resulting in inability to respond in helpful ways. Many parents want their emerging adult children to be independent, but having observed earlier struggles may be fearful and overprotective, and may try to protect them from their own actions. Communication challenges may result in parents not really listening to their emerging adult children. They may want to be involved but don't know how to ask, and conversely, young people may want their parents to be involved but don't know how to ask them. Next slide. Other family support challenges are related to the impact of family stressors. Many parents become burned out because of other stressors in their lives, such as poverty and the needs of other children in the family, which leave them with no energy or time left to focus on their young adult child. They may withdraw from their child because they're burned out from having to deal with issues and negative behaviors for many years. There may be a prior history of conflict or abuse related to intergenerational trauma or parental issues. And there may be a lack of support from service providers who want to avoid the added complexity of involving families and services after the emerging adult has achieved the age of independent decision making. In summary, there are several challenges, but we believe that there are reasons to encourage support from families, and I'm going to talk about some of the strategies that were suggested by participants. First of all, to build positive support from families, participants recommended inviting emerging adults to identify what they need from family, specifically asking the emerging adult who they want as their go-to person for involvement in appointments or to provide support when they need it, and to participate in discussions of diagnosis and treatment. They recommended promoting emerging adults' leadership, describing the advantages of emerging adults directing team meetings and soliciting input and suggestions from families. Wraparound team-based planning approaches developed with younger children may be effective with the emerging adult leading the team. Building positive support from families can be done through pre-planning before transitions so that the needs can be anticipated and prepared for. Building on strengths is always important, and that can occur by inviting the young person and parents to identify and share their strengths while the other listens, and reducing conflict by increasing appreciation of each other's qualities. Communication skills between emerging adults and families can be improved when service providers take care to show interest, facilitate listening, validate perspectives, and reframe concerns as caring. Teaching of negotiation strategies and collaborative problem solving can also be helpful. Education and training for families about mental health, about brain development, about adult development can be helpful, and there are useful tools from books like Rusty Clark's Transition to Independence model, role-playing in sessions, intentional conversations, family team meetings, where families can learn about the needs of their child. Families can also get support from other families as they begin to accept their new role as the parent of an emerging adult, and connections with support groups such as NAMI and educational presentations are helpful for some families, while others prefer their natural support system. Emerging adults can also benefit from peer-to-peer support and education to better understand their parents' perspective and how families can be supportive. Connections with Youth Move and NAMI groups can be helpful there. So in summary, we believe that families can be valuable sources of support for emerging adults with mental health conditions, and there are ways that service providers can encourage this while safeguarding emerging adults' rights. At this point, we're going to transition to Martin Rafferty and Celeste Mosier, who are going to discuss peer support.
Hello everybody, thanks for joining the webinar. My name is Celeste Mosier and I'm project manager of the Achieve My Plan project at Pathways Research and Training Center. And Martin Rafferty is joining me, and we, like Pauline said, are going to discuss another theme that emerged from the conference around peer support. So I'd like to turn it over to Martin to introduce himself and tell us about some of the positive movements.
Thank you, Celeste. Youth Move Oregon was proud to participate in the State of the Science Conference. As an organization that is focused on the larger peer support movement, we were given a sneak peek on the health of the movement and how it's being actualized nationally. And this is important because as of now, there hasn't been a larger focused event like this before. So what are some anecdotal findings based on those observations? We were excited to find out that there's a broad goodwill happening from service providers. And that means that service providers who are offering peer support are in it for the right reason. They're attempting to be actual supports for the peer movement. And it's not a dollars and cents game. They're actually showing a lot of integrity as we're rolling this out. There's a lot of momentum that is building around creating a sustainable system for peer support. So a lot of thoughts going into how can we make it stronger in the future. And that's always a great indicator of health. Celeste, do you have any more on this slide?
Just that there at the conference there seemed to be a strong interest in offering peer support services more broadly, and so I thought that was also a very positive movement in the direction of peer support. Next slide, please.
So we're also seeing that when looking at peer support programs that participated, that it was most successful when the young people and the peer support specialists had a strong relationship. And although this might sound as something that comes very easily to those around peer support, it was great to see it, again, actualized in actual services that were happening. We found that the best peer support providers were professional, but also approachable and relatable to young people, in creating a professional mesh between peer and traditional systems. It was very important that the peer support providers that were there were trying to keep the essence and the community, the things that made peer support its own unique environment. They were working hard to keep that intact. Something that we saw as some needs, and putting this after the positives, is that there needs to be some broader training across the nation. Training that is created to be the same wherever you go, so that when someone says we have peer support, you know exactly what that means. There are some definitions that we also felt like were needed, such as what does it mean to have peer support positions in your organization? How are they supervised? How are they supported? And this all meshes back down to the fidelity of peer support. We were seeing that, you know, the definition of what having peer support in your organization looks like was vastly different from service provider to service provider. So there's a huge need right now for a national movement such as Youth Move Oregon or Youth Move National to take a good look at setting these definitions. And of course that work has already began, but again we got to use this event to kind of see what was needed and to confirm some of the things that we know are needed, such as creating these kinds of definitions and trying to imagine what fidelity looks like.
Yes, and Martin, I would just add that another theme that emerged at the conference was that there does need to be some kind of curriculum or model or something for peer support specialists to follow, but that it needs to be loosely structured so the peer support providers can really customize their approach with their young people and modify when necessary. So that was another thing that came out, I believe.
Absolutely.
And next slide, please.
So again, some questions were inspired that need answering, and of course that's the responsibility of the larger movement. But it was great that we kind of got to confirm that these questions needed to be there. And one of those questions is, what is the role of the peer support specialist in an organization in a service providing model? And how's that role tracked? How do we know when a peer is doing great work? How do we know when they need a little bit more support? How do we know how it's affecting the system, how it's creating cost savings, things that funders and stakeholders really like to see? You know, what are the desired outcomes? And that goes back to the last bit, you know, how do we know that progress is being made? What kind of organizations are going to be adopting peer support specialists, from residential treatment providers to outpatient and inpatient programs? Where do these positions exist? And how do these organizations train, support, and supervise these positions? It's an interesting question about how to really sell a peer support model that can fit in many different kind of nooks and crannies of the mental health world. So really interesting questions that we had, Celeste.
Yes, Martin, I completely agree. And one last thing I'd like to add is it was really interesting at the conference because we had a nice slice of young people who were peer support providers, young people who worked with peer support providers, organizations that are interested in having peer support services. So it was really nice to have these conversations because there was a lot of different perspectives that were involved in the conference. So that was my last piece I would like to add. And now we'd like to turn it over to Eileen Brennan, who is going to be talking about social identity. Thank you.
Thanks so much. Eileen? And just briefly, if people are wanting to know more about Youth Move National, you can look them up on Facebook, Youth Move National. It will come right up. Really great conversations that began at this conference kind of grew into the social networking land there.
Okay, well, I will let Eileen jump in when she gets her audio set, but just to go over, one of the breakout sessions that we had on day one was about social identity, and why would that potentially matter as something that would may or may not help or sort of pose challenges to the model that Janet had proposed. And so the first aspect was that we just wanted to define social identity and refer to it in groups such as race, ethnicity, which are typical for social identity, but also sexual identity, class, religious affiliation, or even age. And so what mattered when we talked to participants about their experience with different social identities is that...
Yes, Chris is talking.
Oh, great. You can go on with Eileen. Thank you.
Oh, okay. Thanks a lot, Chris. We had some technical problems here. So what mattered in the participants' experience was they're working with young people from diverse racial or ethnic groups. They mentioned groups such as the Latino community, African Americans, Native Americans, or indigenous people, and more generally people of color. A lot of the participants worked with those groups. They also had contact with diverse youth who identified as lesbian, gay, transgender, queer, questioning, intersex, or two-spirit. And then some group members also had experience working with young people who practiced the Muslim or Latter-day Saints religion and mentioned issues that arose because of religious affiliations. The second major focus of social identity pertained to lives of young people who had been affected by involvement with service systems or support programs. Foster care or other child welfare services, disability services, mental health services, substance abuse treatment or support, or the juvenile or adult justice systems. Their life circumstances also resulted in young people being veterans of military service, refugees, undocumented immigrants, teen parents, young people who experienced poverty and homelessness, and gang members. So that really affected their lives. There was one thing that was pointed out by participants who worked with specific social identity groups. They pointed out that there is a complexity that can be hidden. So, for example, a person could be involved in more than one social identity group. For example, a Latina teen parent who needs mental health services. And this type of intersectionality really makes it challenging to identify the most salient social identity group or group in the young person's life. If we can go to the next slide, please. They identified some challenges despite their clear belief in the usefulness of the Pathways model. The first thing that they talked about was the focus on the adult roles that is part of the model might be inappropriate for some social identity groups. As an example, in the Native American community, many young people have had adult responsibilities at a young age, and they've had to struggle with the conflict between independence that this model implies and the interdependence that's key in Native American life. The second thing that they talked about was the difficulty in facilitating empowerment given system involvement of young people. One program director spoke really eloquently about the difficulties of doing empowerment work within juvenile justice system constraints. And even with peer support, people who are involved in juvenile justice systems may not consider other peers who haven't had that system involvement to be advocates for them. And finally, when working with young people who are trying to make decisions of their life, the service providers had to help them weigh those decisions they were making and put them within the context of the goals that were already set for them in the criminal or juvenile justice systems. So lastly, another major challenge was mobilizing support available if the life context made it difficult. For example, LGBTQ young people might have been rejected by their families, and they may have to rebuild their social network person by person. Another example was due to religion. Young people who are LDS in their religious practice might not be able to go on missions due to their mental illness, and that may make them feel excluded, and they may have to find new social connections. So service providers talked about working with these young people
by starting at the very basic level of helping them to find allies and resources that they can use to build a supportive network. So I'd like to go on to the strategies. There were some intentional strategies that the participants talked about using from the model. First of all, they worked to convey respect and appreciation for each young person. Some participants focused on the unique characteristics of each person that they worked with. One provider said, "Let our youth educate us about who they are," which is a great quote. They told us that they try to foster a sense of pride and positive identity in young people, and that is something that young people who have experienced being bullied or discriminated against really need. The second strategy that they emphasized was sharing knowledge about what it's like to navigate early adulthood. Pathways researcher Lori Powers spoke about peer coaches who are one step beyond where the youth currently are and might have common experiences of foster care, disability services, cultural background, or sexual identity. Through strategic exposure of shared alliances, these young people can build upon examples of resilience who are their peers. And finally, one final example of the use of positive development practices is providing resources for young people. This might mean that providers need to join with the communities that young people identify with and help them access culturally specific or identity specific supports. And then also they focused on youth that have had traumatic experiences as part of their identity, either prior to or while they were in care. For them, comprehensive trauma-informed services may be crucial. These services can assist young people to rebuild trust, to learn self-calming skills through engagement and relaxation exercise, and to build a path toward their own development when their safety and wellness have been established. So finally, I'd like to share a few ideas about what makes for effective services for diverse young people. You might do the following. First of all, take into account the complexity of their social identities. Sometimes that might mean finding culturally appropriate supports or finding peer support specialists and service providers who are members of the key social identity groups of the young people and who can help them navigate the adult world. The second thing that emerged from our discussions were that service providers really need to know about the social factors that affect health and well-being. So we'd suggest consider participating in the type of diversity training that really prepares you to better understand their social world and the factors such as race, ethnicity, sexual orientation, disability, class, culture, and geographic location that can affect these young people's health and well-being. Also, participants mentioned oppression, which can be a key experience for these young people. They remarked that it's important to keep the social context of discrimination and racism in mind when we work with these young people. We need to develop skills to deal with bias as it occurs and interrupt oppression when we see it operating. And then finally, working to overcome structural barriers that limit access to resources is also needed. And work may focus on making sure that young people are included in opportunities to grow and flourish as emerging adults. So I think we're next going into discussion.
Yes, thank you, Eileen. And so our first question comes from somebody who is asking about how we see systems as mechanisms that might create more barriers in and of themselves. So what, in other words, what are some of the barriers that some of these systems can create to prevent the implementation of our model? And I don't know if Eileen or Janet wants to take that one.
Sure, and actually I posted something in the questions there, so if people are interested in looking at this link, they can. You know, our conference per se and the proceedings, therefore, don't really focus on this, although there is a chapter about systems and organizational barriers. But of course, these are huge issues worthy of several conferences in and of themselves, and people are working on strategies to overcome the system barriers. There is a very nice publication that I have a link to in the answer column that talks about in more detail about systems barriers and approaches, and I've given, it's called Tunnels and Cliffs, and you may be able to access, you will be able to access that if you use the link that I posted in the answer column. I think I answered to everyone, so I'm hoping that everyone will be able to see that.
Thanks. And the next question we have is, how can we assist emerging adults who don't qualify for some of the public assistance or the more public funded programs and are relying either on private insurance or nothing at all?
Well, I'll take a crack at that. Again, this is a huge topic, and in the answer that I posted on the answer, I don't know what that is, pane, I guess. I did talk about our involvement, and it came up during our discussion earlier about the Healthy Transitions Initiative states, 7 states that have been given federal funding to put state and local partnerships, to build those partnerships to make transition services available across their state. And so they describe, they have been working, specifically part of the grant has been for them to work on policy change. And so we are currently working with them to document some of those policy changes. And one thing that we've found is that states can pursue very idiosyncratic approaches that can be equally effective. So it's actually really a challenge to document. But certainly some of what's being now available through the Affordable Care Act as it comes into implementation, and particularly in states where there is now going to be Medicaid expansion, should allow for more opportunities to serve this population in a broader way. Additionally, we have models of now we are seeing increasingly people putting in these health home models where they're combining mental and physical health, and I believe that Missouri is working on a health home model specifically oriented towards transition age young people, emerging adults. And then finally, I'm thinking of an example that we have here from our own state in Oregon, where what started out as a specialty program of to engage young people with early signs of psychosis has now, because that program has had such positive perception as being effective, the state is actually investing a combination of state funds and block grant funds to expand that, not to limit it just to the population. So the population of people who are experiencing early signs of psychosis, that program was open to them regardless of their insurance status. And now the idea is to expand that to a wider population as far as kind of the diagnosis or the eligibility, again, without regard to their insurance status. So it's been a process of kind of building from a core mission and then gradually expanding to serve the population more generally. And that's been really interesting to observe. And then again, a sort of approach that's been kind of unique here in Oregon.
And Janet, just to add to that about the Oregon piece, is that a lot of folks in Oregon have been advocating to legislators and stakeholders and saying, let's look at the data about how these systems are failing to serve these high-risk populations, and how, looking at why those failures are happening, one of the reasons why is that there's not flexible funding. And so utilizing this kind of gap in services as a way to say, we need general funding that, isn't going to be dollar for dollar Medicaid billing, so that we can actually serve a wider range. And yeah, ESA and Youth Move Oregon and some other young adult initiatives that are just starting now are all, have room in Oregon for that flexibility, because of the advocacy that was done to legislators and to stakeholders. It really started with these anecdotal stories in response.
Okay, so our next question is for, maybe Martin, you could start with this, but how do we involve young adults who reject association with others who experience mental health challenges?
The answer to that question is pretty complicated and could be its own webinar. But essentially looking, we've all heard the phrase trauma-informed care. What about looking at stigma-aware care? So basically all mental health services or anything that's associated with traditional mental health services carries a certain amount of stigma. And we found that when we look at how to reduce that stigma, that youth that have been resistant to services, have been resistant to, going to support groups or receiving any kind of services, when we worked on the issue of stigma, we found that they were way less resistant. Part of it, too, is looking away from the adult peer support movement, where it's mental health is something that's kind of celebrated, and being in the movement is celebrated. And for young people, it can't be specifically around mental health. It needs to be about leadership or empowerment. And when we focus on those things and not just the disease, we find that young people are way more responsive.
Thanks. Does anyone else want to address that question? Okay, if not,
I would just like to second sort of what Martin says. I think a common theme in what we have found when we talk to young people and the successful programs is that engaging them directly into mental health services is often not a winning proposition. And to create an environment where people feel that they can come and engage, and that they will engage around things that they find kind of compelling and useful. Usually that will involve maybe getting a job, finding a place to live, etc. And that when they see the need for mental health services, or when they're willing, or when they have built up a level of trust, that may make it possible for them to then access mental health services under those conditions. So certainly it's not unusual to find that young adults do not want to self-identify as having a mental health condition, and often they reject the labels that they've been previously given, sometimes for fairly good reason. If you can imagine that young people may have come up through systems, had multiple different diagnoses and all sorts of different medications. It's not necessarily surprising that they might not self-identify.
And it's just, it's
our next
extreme.
question,
Oh, sorry.
It's okay, go for it, Martin.
Oh, I was just going to say it's extremely important, I think, when we're talking about the issue of mental health, to not make the conversation about the young person being ill or mentally ill for the rest of their life, or that this is some kind of defect in their identity. Because when that happens, they're not, young people, and no one is going to want to, submit to this idea that they're defected. And I think that it's being more and more connected with the physical model. This is an issue that's going to continue to come up. So we really have to make mental health care about wellness and about a focus on positive aspects.
Thanks. So the next question is, how does this model interface with wraparound?
Okay, well, as a resident wraparound aficionado, I suppose, this is Janet. I've done a ton of research with wraparound. I think that the general approach is completely compatible with the overall approach in wraparound. And in fact, one of the projects that we're doing here at the Research and Training Center is a wraparound enhancement that focuses on increasing the extent to which young people are meaningfully engaged in their wraparound planning. Because previous research that we did found that wraparound, kind of the biggest challenge that we identified in wraparound was actually lack of engagement of the young person themselves. And so, you know, wraparound in and of itself probably, I mean, it has the principle of you know, family and youth driven. In practice, it doesn't always happen. So again, it requires that level of intentionality and understanding of the youth's development and how to support their own positive development through the wraparound process, and that means through their actual participation in wraparound, in addition to the services and supports that are provided through wraparound.
Thank you. The next question is on getting the attention of policymakers. So what suggestions do you have for getting policymakers to take action regarding transition age youth? How do we get it on their radar at a time when there's so many other competing priorities? I don't know if Eileen or Pauline wants to chime in on that one, or anyone?
Well, as someone who's observed this in Oregon, I think Martin has great ideas because, again, as he mentioned, our ability to make progress in this state has been very strongly propelled by the engagement of young people in kind of high-profile activities, especially with the legislature. Martin, do you want to comment on that?
Yeah, I think the key to the work that we've done is always about attaching it to issues that are surrounding legislators and stakeholders. So definitely looking at, you know, when systems are costing too much, or, you know, looking at when issues come up that really affect the state or stakeholders, how can you attach data and research about this population with those categories. So it's about constantly looking for those opportunities to bring what's important, you know, in the news locally, you know, that stakeholders are focused on, and pairing that with how are we doing with our young adults? How can we do cost savings? How can we make the system better?
Okay, another question is somebody who's saying that they appreciate the model, but they believe that many of the elements are actively used elsewhere. But I think the main question they're asking is, how do we address some of the hopelessness of emerging adults in being able to see that they have a future potential? This clinician is saying that they can teach all of these findings and these things, but they can't believe that things will ultimately be okay.
Well, this is Janet again, and I mean, obviously we have young people, a lot of whom have some really big challenges. And that I think, though, what it comes down to, again, I'm trying not to just preach this from my own high horse, but based on all of the information that I've gathered from people who work with this population, that the way to inspire hope is to have the experience of success, and that part of the job of the coach or clinician is to help the young person and to actually carefully construct circumstances so that the young person can exercise their self-determination and initiative and find some success. Now, of course, they're not always going to be successful, but the way to build self-confidence is obviously through the experience of doing things that work. And I think that another issue I think you mentioned in your question, that you're a clinician, and I'm not sure what kind of program that you work in, but I think this is also partly why the successful programs and approaches that we reviewed in the literature recommend a comprehensive approach, because clinical services in and of themselves, it's kind of overloading or overburdening expectations for clinical services to say that they will be able to help with things like finding a job and a place to live and social support, etc. And that is why a kind of a multi-pronged and comprehensive approach is part of what is essentially required to effectively address mental health conditions. Anyone else?
So one question, somebody asked, how do we support youth support specialists in their own transition into emerging adulthood? And I just wanted to use this opportunity to promote a publication that was written by Youth Move National that's available on our website that is on transitioning to adulthood and how young advocates can make that change from a youth advocate to advocating for youth. So if you go under our featured products, you will see that publication. And our next question...
Oh, can I just add something, Chris?
Oh, absolutely.
We're also right in the process of producing 3 case studies from our research on peer support, and they describe, describe different approaches that have been used to sort of implement the peer support model in 3 very different contexts. And so there's a little section, these are fairly short briefs, but there's a little section in each of those that describes kind of both the support that's given officially kind of through supervision and mentoring, but also describes sort of the challenges of young people for whom this may be their first job and so on, and who may have issues related to working with systems and who may have biases against systems, but also, again, bad experiences, and kind of how these programs approach supporting young people in the light of all of these different issues that can come up. So one of them I think is already online. The other one should be appearing really within a few days. And the third one is actually focused on Youth Move, and that one should be coming out soon as well.
And speaking of youth participation, someone's asking about insights into effective means of getting young people to the table to begin chats and discussions about this model. Martin, or maybe Eileen and Pauline in your experiences with the modules?
Yeah, I mean, I think that you have to always, when thinking about using research or any kind of educational tools that apparently are more have more of a stake for professionals, is that you kind of have to translate what it means for the broader movement and what it means for the work that's going to be done. So in other words, when utilizing this model with young people and trying to use youth leadership to implement it, the conversation needs to be had about how is this going to affect the work that we're doing, how is it going to legitimize it, and then what are we going to do, with those lottery winnings? Whenever the lottery gets to $200, $300 million, people dream, what are we going to do with all that money? Are we going to buy an island? Well, it's the same thing in this work, right? You have to kind of think about what happens when we legitimize this work, what happens when we have more funding and more support, what's the dream program like? And I think when you frame it like that, you're going to get a lot more interest from youth leaders.
This is Janet. I'd like to build on some of the things that Martin was saying as far as getting young people to the table. I think it's a process that takes some time because kind of breaking into those kind of adult and I would say bureaucracy-driven discussions is not always something that's very easy for young people, even when they are highly motivated. So there are kind of a number of different strategies. The 2 that I kind of like the best are, first of all, when you expect a young person to kind of start participating or join an existing board or group or committee, that there is someone who is experienced and highly regarded existing member of that committee who becomes a mentor to that young person and explains to them kind of the history, what are the issues, helps them understand and debrief so that they can kind of get in that level of insider's knowledge. It's very difficult to acquire for anyone who's approaching this kind of work for the first time. And that person can also be kind of assigned to help once the agenda for the whatever the occasion is appears, to help the young person understand those specific issues and prepare to participate. Because again, confidence, nobody likes a meeting where they feel like they can't say stuff. They think, oh, I have something to say, but I don't know, is this the right time? And that's a very frustrating experience for anyone. I think the other strategy, that is one, again, that I'm very, I guess, pleased to see Youth Move in Oregon implementing, is to start building a broad cadre of leaders in the community. And so Youth Move has, in Oregon here, has been very diligent in providing leadership opportunities. They have a leadership training that goes on for, I think, better than half a year, or something, 30-some weeks or something, Martin. And that builds the capacities of young people working together, builds their confidence, and helps them also to kind of discover a collective identity that I think makes it easier to become an advocate, that it's not just you speaking about your issues, but you understanding that what matters to you is also shared. And I think that also helps to ignite the passion that keeps you going through all the frustrating experiences that come along with trying to make changes.
Exactly, and the tagline for this 36-week leadership training program is we help young people become leaders in their own lives and then in the system.
Well, thank you very much for your participation in this webinar today. Before we completely close out, I would like to mention that we are working on some training modules associated with a lot of the ideas that you heard today and are currently piloting those. The announcement for that pilot has been shown up in our newsletter, but you can also contact Eileen Brennan or Pauline Giovangi, who are available on our website to learn more about that, to maybe participate, to gain some additional training and give us feedback. So that will be it for today. Thank you very much for coming and attending our webinar and learning more, and I hope you come to our website to get more information about all the ideas we talked about today. Thank you very much, and goodbye.